What exactly are we losing during the day that we regain during sleep?
Sleep related driving accidents
Yeah.
far outnumber drunk driving accidents
Yeah.
across the world.
Every night we are going to a place where we have no control of our own body.
He was of the opinion that most of the sleep apnea patients present to psychiatric clinics and not just neurology or pulmonology or ENT. How do you deal with this patient who comes to your OPD and says, मैं जब दारू पी के सोता हूँ, whenever I drink alcohol, I snore. Otherwise, I'm fine. We have already started talking about 70-hour work week. When do we start talking about 56-hour sleep peaks?
What you gain in sleep is...
So I welcome you all to today's podcast, and this will be a very interesting podcast today. This is focused on World Sleep Day, which we are going to celebrate on March 14th. The theme for this year is Make Sleep Your Priority, and that's what we are going to discuss with our guest today. So I welcome Dr. Sid Warrior, and Dr. Rahul Modi. Thanks for being on the show, sir.
Thank you for having me.
Thank you for calling us.
So it's always wonderful to connect with you both, and you both, like me, let's say are sleep doctors or maybe sleep enthusiasts will be the right word.
Yeah.
So all three of us deal with a lot of sleep issues, and what I wanted to bring out through this podcast was that we see sleep issues, sleep disorders in a lot of different ways, and maybe different specialities get to see sleep disorders in different ways.
Yeah.
So I'll introduce the guest first. Dr. Siddharth Warrior, as you all know, he's a KEM pass out, then went on to do his neurology DM from SGPGI Lucknow.
Yes.
So has been a A grader through and through. Dr. Rahul Modi again has been a PGI product from Chandigarh and then went on to study in Stanford Medical School. So currently you are a visiting faculty at Stanford, right, sir?
So I was for a point in time. So technically that duration is defined by the time that you visit. So I was at a point in time a visiting faculty.
But still it's a
it's
feather
something
in your
that,
crown.
and it's a place that I think for the time I was there and the learnings that I had on a per capita basis, that was the highest learning
That's
per hour that I was there.
That's a
I
very
thank my
interesting way
teachers.
to put it.
I thank my teachers immensely for the experience that I had there, because it was I would say a very new way of approaching medicine from the standard traditional way that we practice, I would say, anywhere else. But Stanford, that is what I liked, because I got exposure from being from the ENT background. It was very unique to get exposure from psychiatry, neurology, proper sleep medicine, then ENT, of course, then pulmonology and pediatrics. So it was very unique to get that kind of an exposure to.
So you must have learned a lot of sleep
Yes,
aspects in
yes,
Stanford.
yes.
So Dr. Sid, what about you? How long into your career of neurology or as a MBBS student, did you realize that sleep was the best health hack that was available?
Oh, I would say it's been a growing realization, because as an MBBS student, you think of sleep as just one small aspect of health.
Yeah.
In fact, you think of sleep as a long answer question.
Yeah.
You don't even think of sleep so much.
Yeah.
Neither in your personal life nor academically. Sleep is not really high up
I
there.
think doctors are perhaps the most underslept of the community that are right there,
100%.
despite knowing the benefits of sleep.
Yes. Now, the number of doctors telling others to sleep while having poor sleep themselves is very high, for sure. But sometime in MD medicine, I started realizing the importance of sleep, because we did a study where the ICU patients who were able to sleep had better outcome than the ICU patients who did not sleep.
Interesting.
With all other parameters kind of being similar. So we realized that maybe having constant beeping noises, having constant sounds in the ICU is not a good thing for patient recovery.
Yeah.
Because it definitely, even a normal person cannot sleep in the ICU with all that sounds going on.
Exactly.
So sometime in MD, because of those studies, I started realizing sleep is important.
Yeah.
Neurology taught me at another level.
Yeah.
Why is sleep important? Because even in cases of Alzheimer's and Parkinson, poor sleep is a risk factor for all these cases.
Yeah.
And in the last few years, because of my interest in mental health, I've started reading about the neuroscience of sleep and how it is connected to depression with anxiety. So now I would say sleep would be the top hack.
Yeah.
If somebody wants to improve their lives,
Yeah.
without improving sleep, I don't think anything else can happen.
So even diet and nutrition come a distant second.
Yeah, I wouldn't say distant second, but definitely second after sleep.
After sleep. So if
Yes.
sleep's not there, no amount of diet control or exercising can help you.
Correct. You cannot out health practice a bad sleeping.
So I
habit.
was going through one of these research papers which talked about the association of sleep, like less amount of sleep and glucose metabolism.
Yeah.
And it said that proper exercising during the day can partially offset those disturbances that you acquire during insomnia period. But they stressed on the word partially. So
Right.
the amount of metabolic control you gain due to a proper sleep cannot be achieved due to exercise or even diet control. And this is, I think, now more or less established in most of the research that sleep is the one hack that you have to get it right.
Yes. Yes, absolutely. Because at every level, from the gut to your metabolism to your cognition, sleep plays an important role.
Yeah.
So it's not like only your brain is sleeping.
Yeah.
Your body is also sleeping. Your muscles are also sleeping.
Yeah.
The metabolic system, the hormone levels in every organ changes during sleep.
Yeah.
So that's why every organ needs to sleep.
Yes.
So that's the reason why it will affect everything in your body.
Exactly. So coming to Dr. Rahul now. So I had one anecdote that I would share with you here. So during my MBBS days back in AIMS, so one of my batchmates during the sleep lecture in physiology class raised his hand and said, what exactly do we lose during the day that we regain during sleep? Now, at that time, it seemed like a straightforward answer to me. It seemed like energy was the one answer to this question. But now I realize how profound that question was. And I would pose the same question to you, Dr. Sid. What exactly are we losing during the day that we regain during sleep?
It is a very interesting question because I think there are different ways of looking at this. As a neurologist, I would say that your brain's metabolic system is highly active throughout the day. You are constantly thinking, planning, and these metabolic systems take a toll.
Yeah.
And there is a gradual accumulation of waste products that happen within the neurons, which is the brain cells.
Yeah.
So one thing that happens during sleep is that a lot of the detoxification happens in sleep. Housekeeping functions. The so-called lymphatic pathway in the brain, which is responsible for cleaning up of all the extra debris.
Yeah.
So that happens during sleep. So what you gain in sleep is decluttering.
Yes.
And if over a period of time your brain gets cluttered, then those are those protein fragments that inevitably cause those tau proteins and neurofibrillary tangles, which are basically proteins mashed up together in abnormal ways.
So brain is not resting during sleep. It is taking care of itself and other body organs at the same time. So it's like a housekeeping function that body is performing during sleep.
Yes.
It is not 100% resting.
No, absolutely not. I think the parts of the brain that are active change.
Yeah.
So a different group of neurons get active.
That's
during
a
sleep.
really interesting way to put it. Like the different parts of brain light up during sleep, and if you really see it on a MRI machine, then different regions in the brain light up during sleep, taking care of all those regions that are active during the day.
Yes.
So basically, housekeeping is what happens during sleep.
Yes.
So, Dr. Rahul, we have already started talking about 70-hour work week. When do we start talking about 56-hour sleep weeks?
So I think it comes from awareness. First, like I said, as keepers of health, as someone who talk to the population at large and someone that people come for advice, first we have to inherently believe as a medical fraternity that sleep is something that plays a very important role. As a neurologist, definitely, Sid must have got a lot of experience and exposure to sleep. But as ENTs, sleep was never a part of our curriculum, so to say.
Yeah.
We were never, I don't even remember physiology sleep class, if you ask me. I'm sure I must have attended all lectures, but that's that. So I feel somehow slowly, and surely, more specialities and more doctors are becoming aware about the importance of sleep. And the way I look at it, it's part of the whole, rather than being a whole in itself. So it's like good diet helps me in better sleep. Good exercise helps me in better sleep. And sleeping allows me to do better exercise.
Yeah.
Sleeping well allows me to adhere to a diet.
Yeah.
So if somebody is trying to lose weight and somebody is, say, having sleep apnea, then without treating his sleep problem, he'll find it very difficult to lose weight.
Yeah, that is one thing we see day in and day out.
So that awareness, say, like, even a dietitian should be aware about the importance of sleep.
Yeah.
Even, say, a fitness trainer who's training someone in the gym should tell him that, along with gobbling whatever levels of protein and creatine that they recommend, they should recommend all those people to sleep well too.
Yeah.
So, that is how I see it in terms of being part of our daily communication, and also not to wear low sleep or the fact that I am working 48 hours days and I'm not slept enough as a badge of honor.
Yeah.
I think it should be frowned upon. Like, how people, how we not encourage, I had 2 binge drinks and then I'm back to work. It's not something that people wear as a badge of honor. Like, I had a binge drinking night or whatever. So same thing with sleep is what I would say, is that in the general communication, it should be that, we all want, like, we are all surgeons. We would want the surgeon to be well rested before a surgery. Yeah. We would want the pilot to be well rested. Yeah. We want that locomotive driver who's going to drive on those railway engines on long journeys, on dark nights, with whatever weather that he has to face, to be well rested.
So this reminds me of a very interesting study from a trauma center back in AIIMS that said that 80% of the accidents that happened could be prevented if the driver was well rested. Absolutely. And happened because of something called a micro sleep that happens because of lack of sleep.
So sleep driving, to emphasize that point, or sleep related driving accidents far outnumber drunk driving accidents across the world.
Exactly.
So you are more likely to meet with an accident if you have like lack of sleep than meet like an exceptionally drunk driver who's driving. And I'm not saying you should drink and drive, but what I'm trying to tell you, it's more common for lack of sleep to cause accidents, especially for those commercial truck drivers, than finding them drunk and driving that vehicle.
So the slogan should be like, get well rested and drive, along with don't drink and drive.
Absolutely.
So it is as important.
Absolutely.
And one of the problems is that with sleep and driving, the closer you are to sleep, the poorer your decision making.
Yes.
So
it's like alcohol.
It's like alcohol. So sometimes if you are sleepy, you might end up deciding to drive because you are not thinking straight, because you are sleepy.
Yes,
absolutely.
So that is a very tricky situation. So can you even trust yourself when you decide that chalega, I will drive, it's only an hour, I won't be sleepy. So that poor decision itself can be because of lack of sleep.
Yes.
So you have to be very careful.
So it is a very important point. I think that even you have to set boundaries for yourself. If you are not well rested, you have to take a cab or you have to ask somebody else to drive, almost as if you are drunk. And it should not be frowned upon. It should be taken as a healthy habit.
Yeah.
That is, I think, one message that we can send to our viewers through this podcast.
Yeah.
So, Dr. Sid, coming to you, what are the different phases of sleep? Like sleep, from, as we know, it's a 7 to 8 hour process, but not all the hours are similar. Every hour something different happens, and losing an hour of sleep during the morning hours is very different from losing an hour of sleep early part of night. So just walk us through it. What are the different phases of sleep?
So we can talk about it in the stages of consciousness to deep sleep. So consciousness is fully awake.
Yeah.
So when you're fully awake, your brain is reacting to whatever is going on around you.
Yeah.
You can sense everything in the world outside. You're thinking and you're capable of reacting.
Yeah.
Right. So this is the loop of a wakeful state.
Yeah.
When you go off to sleep, the first things that happen is that your awareness of the outside world keeps on reducing.
Yeah.
So you see less, you hear less as you go deeper and deeper into sleep.
Yeah.
So stage 1 is when you go from awake state to early sleep state. And then as you keep going deeper, you go from stage 1, stage 2, stage 3, stage 4.
So it's like walking inside a basement, descending through the stairs to a basement.
Correct.
Yeah.
Once you've reached stage 4, which is the deepest level of sleep, this is when you are neither capable of awareness nor are you capable of reaction. So you can neither sense what is going on around you, nor can you move.
Yeah.
Okay. Now, from that basement, there is another staircase up, which is called REM level.
Yeah.
So stage 1 to stage 4 is NREM, which is non-rapid eye movement.
Yeah.
So this is the stages as you keep going down where your body is paralyzed. You are not capable of moving. Now, in REM stage, you are still not aware of everything around you.
Yeah.
But in this stage, your body is capable of some movement. So this is where your eyes move, which is why the name exists, rapid eye movement.
Yeah.
So your eyes can flutter.
Apart from your cardiac and respiratory muscles. Yeah.
All your internal organs movements are never affected, no matter in what stage sleep you are. In fact, even in coma, your heart, your breathing, all those things are usually still going on.
So it's a coma-like state, except that your mind is active and your eyes are active, and you're basically, this is a dreaming state.
The difference between coma and sleep is arousability.
Yes.
If I shake somebody who's in deep sleep and they wake up, that is how I know they are not in coma.
Absolutely. Exactly.
Otherwise, technically, we go into coma every night.
Yeah.
Except that you come out of coma.
Arousable coma.
Arousable coma is sleep.
So that's a miracle that happens to us every day.
Absolutely. Because we are technically every night we are going to a place where we have no control of our own bodies.
Yeah.
So we are trusting our brain's old evolutionary systems to wake us up.
Yeah.
And every morning when you wake up, when people say that you should have gratitude, it's true. You should have gratitude towards your brain's norepinephrine system because it was capable of waking you up.
So you said that this is a very vulnerable state.
Yeah.
So, of course, as an evolutionary point of view, it must be put to debate as to why such a state existed in the first place. When it made you vulnerable in the wild, why does sleep exist? Like, we are yet to find an animal species which doesn't have sleep.
Yeah.
Even birds sleep while flying through half their brain. We know of fishes that sleep with half their brain while swimming actively.
Yeah.
So sleep is a omnipresent phenomena across the animal kingdom.
Yeah.
However, it makes us vulnerable in the wild. Every night, every sleeping time. Yeah. So why does it happen then?
The only answer, I don't have the perfect answer yet because we honestly don't know yet.
Yeah.
But the couple of points that we can look at is, one, there are no perpetual motion systems in the universe.
Yeah.
Nothing can keep running forever. So everything needs to run and everything needs to rest. Yeah. There is a waxing and waning in every single system.
Yeah.
Right. Whether it's tides of the ocean or whether it's weather systems or natural systems, everything has to go up and down. So similarly in the body, work and rest need to alternate.
Yeah.
Because otherwise we are talking about a system that can keep on running.
Yeah.
Which is physically not possible.
Yes.
Right? So anybody who tries will pay the price for it.
Yes.
The other explanation for why sleep exists is, I believe that our brain not just resting, but our brain also needs to consolidate.
Yes.
You cannot just keep collecting without learning how to put this to use.
Yes.
So our brain has picked up a lot of information, but you cannot consolidate while you are picking up.
Yeah.
So if you use a different metaphor like cooking, there is a time to shop for ingredients and there's a time to use the ingredients. Both of these things need to happen for the food to be on the table. So hunting gathering is the active form. So you're hunter gatherer of information, but at some point you also need to consolidate the information.
Yes.
So the other school of thought is that sleep is when information is consolidated.
So I think not just information, our emotions also get consolidated. We become a much more stable person when we keep sleeping regularly. I'm sure you must have also had those days when you were not rested properly, and maybe those were not the days when you felt like seeing your OPD properly.
Oh yes.
Yes.
Absolutely. In fact, just to bring a small point there, emotion is also information.
Yes.
At the end of the day, to our brain, emotions are also data points, except that data points are so deep down in our brain that we are not consciously aware of them. But they're also information at some level. And if you were to keep an emotion diary, and if you were able to correlate this with your sleeping pattern, 100% you will notice that the days you've felt good are the days after you've had a couple of good nights sleep.
Yes.
Absolutely.
And then we will blame everything but sleep. We will blame our partners, we will blame the government, we will blame traffic. We will say कि इसके वजह से मेरा mood खराब हो गया है. Anything except sleep and hydration.
I think we as surgeons can vouch for it. The days when you are in the OT and you are well rested, somehow everything seems to follow a particular pattern smoothly. And those days when you are not well rested, like the days during residency, I can vividly remember when I was not well rested, I could barely concentrate in OT.
Right.
And I'm sure that must have happened to you also. Like muscle memory also needs to consolidate.
So
right?
More than muscle memory, I think our stress taking ability increases when we have slept well. So see, I personally always found sitting in the OPD far more exhausting than doing a surgery, if you ask me. Because surgery, I'm focused on one task and it's a familiar scenario. I know the next steps very well. I've done it too many times. So part of it is muscle memory and part of it is knowing what's going to come next.
Yes.
OPD is a different beast.
Yeah.
Where you're next
dealing
patient,
with humans.
you're dealing with humans, you're dealing with emotions, you need to run on time because there are appointments in place. So I feel if I'm not that well rested, I may be okay with a routine surgery. Something that I'm doing in day out. Not a tricky surgery, not a challenging surgery, but a routine surgery. Whereas I'll be a little more, I would say, I'll definitely have a cup of coffee before that OPD that is going to come up, where I'll get those 15, 20, 25 patients coming in with all sorts of questions and they're worried and you have to calm them down and to answer their questions and continuously. I feel it's very important to stay aware at that time, and that's difficult with the lack of sleep.
So let me come to the topic of interrupted sleep. With this, I think we have laid the perfect foundation for the benefits of sleep and the harms that a sleep disruption can do to you. So let's talk about interrupted sleep. As a parent to a 2-year-old daughter, I can very well relate to this. And we've had so many nights where we could not sleep well properly, or we had so many interruptions, and I could actually sense in my behavior the next day that I was a bit on the edge because of this. So I think this happens with most of the new parents. And what is your take on sleep disruptions? The medical term for it being sleep fragmentation.
Yeah.
What do you think? What are the mental effects? What are the neuro effects that it has?
The simplest way to describe it would be, if your sleep is getting disturbed, your body interprets it as you are not in a safe space.
Okay.
So that is the underlying principle behind everything that follows.
Okay.
So anatomically and at a hormonal level, a lot of things happen when your sleep is fragmented. If you have to keep waking up for whatever reason, but the way your body interprets it is, this is not safe.
Okay.
So, because safe space means uninterrupted sleep.
Okay.
So when you go to sleep, like you said, we are in a vulnerable state. If you have woken up after 8 hours feeling rested, it is proof that I was in a safe space.
Absolutely.
And so you end up being able to sleep better in that same space later, because now you have proof that I have slept safely here before.
Okay.
Which is why a lot of people have trouble sleeping when they move to a new room or a
Absolutely.
new hotel.
First night effect.
Yeah. Right? Because it's a strange environment. So when you start sleeping in the same place again and again, you will get more comfortable there. Sleep fragmentation will increase stress levels in your body. So cortisol levels can go up. It can lead to all the downstream effects of increased stress, which is, it can lead to blood pressure dysregulation. It can lead to anxiety.
Yeah.
It can lead to lack of focus. Brain fog is a very common term that has been thrown around these days.
Yes.
One of the commonest reasons for brain fog is fragmented sleep.
Absolutely.
Because information collection happens, but if information consolidation is not happening because of sleep fragmentation, you feel like kuch samajh nahi raha hai. What is going on? I know that you told me this yesterday, but now I can't somehow remember.
Somehow your CPU is totally occupied, and
Your RAM.
there's no
Your
RAM
is
to
not working.
Correct.
take in new information.
Correct. So all the browser screens are still open because you've not been
Yes.
able to save any of the information.
Exactly.
So that's why everything is slow.
Your i9 computer, is i9 available, or i7 computer has slowed down?
Yes.
Yeah.
So that's what sleep fragmentation does.
So-
you are not able to complete your sleep cycle, so your consolidation is not happening.
So now talking about stress levels, Dr. Rahul. So stress levels should be harming your cardiovascular system as well, your heart and your lungs and other
Sure.
parts of the body. So because of sleep fragmentation, it's not just the brain who pays tax.
Right. So think of sleep fragmentation, or think of sleep, we think of sleep as a unitary concept. We think of two states of being, like either we are awake or we are asleep. Actually, that's not the case. There are actually three states of existence, is the way we look at it. One state of existence is when we are awake. One state of being is when we are into what Dr. Sid mentioned as non-REM sleep, or the sleep which is the initial part of the sleep, or the sleep which is responsible for our physical recovery. So if you notice, say you have an examination the next day and you're studying late in the night, you've slept for 3-4 hours, and then you have to wake up and go to write the paper. So in that period, you feel physically okayish. You're physically not that tired, but mentally you're very clouded. That's because you have not got the third part, which is REM. So depending upon the interruption, now the difference between the simple way I remember between non-REM and REM, REM is being the rapid eye movement sleep, is in non-REM, both my brain and muscles are shut. Whereas in REM, the dream part or the brain activity, so to say, is going on, but my muscles are still shut. So if I'm going to see a tiger in my dream, I'm not going to jump out of the bed and act upon that dream.
That's a protective mechanism.
That's a protective. So that's why the paralysis, so to say, during the REM sleep. Whereas when I'm awake, both my brain and my mind is active. Now whenever I create interruptions in the sleep, So the order is you will go from wake state into non-REM sleep into REM sleep.
Yeah.
Now at any point in time, say I have an interruption in stage 2 of non-REM sleep, then I have to, again, my interruption will be called as an arousal. I will be awake.
And I have to start from
I have to start from
block 0.
stage 1, then stage 2. So what happens if I'm getting frequent interruptions? So when you talk about stress and when you talk about a young baby, if I'm getting a young lady to my clinic with headaches, the first thing that I ask them, are you getting good sleep? And do you have a young one? Or rather, if I get a young lady coming to my clinic with a 6-month-old or a 1-year-old baby in tow, then I know this lady has got headaches, because it's very unlikely that, she's got enough sleep that she'll be well rested. So, I mean, that's the case. So, stress, yes. Now, if I don't get enough REM sleep, because for REM to happen, I need to typically spend 60 to 90 minutes in non-REM sleep. So if my interruptions are happening once every hour, like we were discussing, somebody with, say, frequent urination at night, so that individual will have relatively less REM sleep, even though he has clocked 8 hours.
Yeah.
So although we say that we need 8 hours of sleep, he's getting 8 hours, but he's still having that brain fog because he's not transitioned into that
deeper phases of sleep.
Yes, that housekeeping hasn't happened, body isn't physically rested, and he is more prone or less likely to handle any kind of stress better than, say, a guy who's well rested.
So it's like the same analogy that we were talking about, descending
Absolutely.
into a basement. You are descending 3 steps and then coming back up, and then descending 3 steps and coming back up. You're not descending into the deeper space, which clears your mind. It gives your mind a good rest.
Absolutely.
So your stress levels increase, your cardiovascular system pays a price, your mental system pays a price. So interrupted sleep is a bad quality sleep, so to say.
And it is both a cause and effect of stress.
Yes.
So stress can also prevent you from going deeper into the basement.
Yes.
Because understand that if you are stressed, your brain is telling you it is not safe to sleep.
Absolutely.
Which is why there are some people who are very easily arousable.
Yes.
थोड़ा सा भी आवाज आ गया वो उठ गए.
Light sleepers.
Light sleepers. A lot of doctors are light sleepers क्योंकि 3 साल रेसिडेंसी के बाद तुम कभी उतना डीप सो ही नहीं सकते.
Yes.
कभी भी सिस्टर का फोन आ सकता है, कभी पेशेंट का फोन आ सकता है. So
that dreaded phone call. I used to hate those ringtones on my mobile. That duty mobile ringtone. So
8 बजे का 7 बजे का ना वो mental alarm, even if you have slept at 6, the body will wake you up worrying that you have to reach for that rounds and you have to reach for those
your circadian
meetings.
rhythm settles.
Part of it is circadian rhythm. Part of it is also, like he's saying, the lower arousal threshold that we talk about, that people are far more sensitive, and there is a lot of data overload also happening. You are watching that mobile phone till very late in the night. You're watching that Netflix movie till you drop dead. So your brain is extremely stimulated, and then that stimulation or that adrenaline rush remains in the system longer.
Because if the aim is to get to the basement, if you're starting off on the ground floor, it's easier.
True.
But if you start off on the 10th floor, कब पहुंचोगे तुम basement?
Yes.
Exactly. So I like the analogy that I saw in one of your videos previously. It's like parking a car. You cannot park a car driving at 100 kilometers.
Absolutely.
That analogy was from Dr.
Yeah, so that is how, So one of the things that we say is like, you have to slow down the car. When we talk about good sleep hygiene, when we talk about good sleep practices, it's good to have that half an hour at least stimulation free. You don't want to read that Twitter feed. You don't want to get stimulated by that WhatsApp message which is being circulated, fake or not.
Yes.
You want, like he was saying, find a safe space for your mind. Find a way where you can tell your mind that this is the place that you can really let down your guard. And you don't have to be up and against and reply to that
slow
message.
It down.
To half an hour prior to 1 hour prior, you should slow it down. And find that parking space, so to say.
And
park
that's
the
not
car.
a waste of time. It's an investment into your
Absolutely
tomorrow.
not waste of time. Absolutely not waste of time. In fact, my advice to my patients, if I may, what I tell everyone is we have 24 hours in a day. Please plan 14-hour days because you need 8 hours of sleep and 2 hours have to be buffer because you can't expect to run around everywhere, be everywhere on time. And then, I mean, it's like, living a life without buffers, it's like calling for trouble.
Burning from both the ends.
It's like, again, parking the car. If I park it very close to the next car, my chance of scratching the car is much higher, either by me or the other guy when he's taking the car out. Life is all about buffers. So day should also be about buffer. We should be efficient, but we should not be miserly with our time.
I think that's a very important message with the way things are. Like everybody is continuously on work.
Yes.
You never are off work these days. Your mobile, your WhatsApp.
There's always something that will excite you. Distract you. And that's why again, it comes down to understanding the discipline, right? So if you have a disciplined routine, then then you will be able to get over the stimulation and the extra excitement that is all floating around.
So doctor said, let's say I'm a 30-year-old techie. I work on like 5 days a week and I take rest on weekends. I catch up on my sleep on weekends. What sort of advice do you have for me? I'm not in good shape and sleep will do me a world of good. So what sort of measures do you advise me on how to achieve a better sort of health for myself?
One thing I would definitely talk to you about is the relationship between sleep and your body's capacity to deal with work pressure. Because I feel a lot of people misunderstand and say that sleep is what happens when you are done with work. And if work is not done, then I can let go of sleep.
That's so wrong.
That is very wrong. So the way that your body deals with any sort of work pressure, your body needs to be regulated. Specifically, the autonomic nervous system in your body needs to be regulated. That is how your body is able to navigate sudden new stresses. So if your boss calls you and says, oh, you have a PPT to make tomorrow morning, how your body deals with it will depend on whether you have slept properly or not. So I would first take out 10-15 minutes to talk to you and let you know that if you want to grow professionally, if you want to get ahead in your career, focusing on sleep is an important part of that.
Sleep is an investment, not an expenditure. That's what you'll tell.
Yes.
Very well put.
Very well put. Absolutely. One very important thing that I wanted to highlight was how people often don't think about this, but in sleep, your breathing rate falls down significantly.
Right.
So if you're awake, you might be breathing 16, 18, 20 times a minute sometimes. But when you're asleep, it can go down to even 10 or 8 breaths a minute, even 6 breaths a minute if you're breathing very slowly, especially in deep stages of sleep. There have now been enough studies showing how prolonged deep breathing calms your nervous system down.
Absolutely.
So there is a term called resonance frequency breathing, which is when you breathe at the same frequency as the blood pressure variation in your body. So in your body, blood pressure changes. That is, blood pressure goes up and down approximately 5 to 6 times. If you are able to match your breathing to your blood pressure variation, there is a resonance. And your body's autonomic nervous system calms down much faster. Heart rate variability increases. Heart rate variability is the new in thing. All the health freaks know about heart rate variability. Athletes know about heart rate variability. I hope that now everybody will know about heart rate variability. So the way to increase heart rate variability is through resonance frequency breathing. Sleep is the number one predictor of heart rate variability. So the better your sleep, the better your heart rate variability. The better your heart rate variability, less chances of anxiety, less chances of brain fog, less chances of confusion, all these things. So as a techie,
Yeah.
is somebody who I'm assuming would be keen on tracking your body, checking how much omega-3 fatty acid supplements should you take.
Yeah.
If you're doing all of that,
Yeah.
checking heart rate variability and getting good sleep would be number one.
So without sleep, none of these supplements really
None of it
matter.
work.
Yeah. So Dr. Rahul, what is sleep hygiene? What do you tell to your tech patients, your urban crowd on how to deal with sleep pressures and daily pressures?
So the easy guy to manage is a guy with a day job.
Yeah.
We'll talk about shift work guys a little later because that's a different level of challenge in managing them. The easy guy is a day job, and I would say it's simple things. Come to breathing, we know about pranayama.
Yeah.
I mean, there was somebody smart enough 2000 years ago to figure that out.
Yeah,
And,
absolutely.
without any fancy gadgetry
Yeah.
at that time, without any modern tools at that time, that we need to have controlled breathing. We need to have good breathing. And I strongly feel pranayam should be part of most of our daily routines. More so in the preventive manner, and preventing a lot of stress related issues. I feel personally it helps in preventing a lot of sleep related breathing problems also. So that's one part of it. Second is getting a routine in place. I would prefer someone have typically now what I've seen is what happens is we know this, we need to eat on time, we need to sleep on time, but we get away with breaking these rules till we are in college. I would say if we are lucky, early 30s. 35 and beyond is when I feel that we get started penalized for not getting that night sleep, doing that late night with our friends, doing that late night at job, emergencies or whatever, is when people come back to us with the symptoms. But if you have the right practice to begin with. Next is, I would say, stimulants. Coffee is big. Coffee is becoming big in urban India, and I'm sure and even tea for that matter has a significant component of caffeine in it. So chai is our national drink, so to say.
Yeah.
So timing that stimulant well. Earlier we used to think that we were able to wash out these stimulants out of our systems within 4-5 hours. Then we thought that 8 hours is good enough. And now if you are someone with a very sensitive sleep, somebody has a very light sleeper, studies have shown that you should take your last drink 12 hours before
to
your
your bedtime.
intended bedtime. So you have to time that well, especially so if you're someone who's sensitive. We talked about screen time half an hour back and having a space. The other challenge that is there is the urban guy who's doing work from home.
Yeah.
Because in a city like Bombay, I don't think people have 5 BHKs commonly where they have one room dedicated as a workspace. They end up doubling their bedroom as their workstation, which again is a state of mind. It's the place where I'm keeping my mind active, alert, constantly thinking, and then suddenly you want me to switch off and lie down in the same space. So
Doesn't
bedroom, ideally bedroom is a space which should be a safe space. We should not be a workspace. You may choose to work in your hall. You may choose to work in another bedroom if you're lucky enough to have that. But try to keep your bedroom space sacred, especially if you're struggling to sleep at night. So those are the basic tips. I mean, I would say to simplify, keep a simple routine. Stay away from stimulants. If you are someone who's not getting good sleep, time your stimulants well, and also to create a safe space where you are keeping work away.
What I have realized through my years of medical practice is that regularity is perhaps the most important.
True.
Yeah.
If you start sleeping on the same time and start waking up on the same time, day in and day out, ultimately you find your rhythm.
Yes.
And definitely your sleep hygiene measures like slowing it down half an hour prior to bedtime, they all come into play. But I think regularity is so important these days. And you cannot be expecting your body to recover after maybe 5 days of irregular sleep
Absolutely.
and catching up on the weekends. There's no such thing like
Yeah.
catch up.
Catch up with the sleep debt that
Yeah.
you have created.
Yeah. So sleep debt never gets paid off.
Yes.
So, coming to breathing during sleep, you both mentioned in your like when I asked you about sleep hygiene, you both mentioned about breathing.
Yeah.
Let's go into the nuances of breathing. So, the breathing does slow down. It happens because of the parasympathetic nervous system.
Yeah.
Your the calm state of mind that happens during sleep, but not everybody is calm during sleep. We have talked about stress that happens during sleep. So does breathing interruptions, like do they really affect your brain and your heart, and does it cause stress levels to go up during nighttime? What sort of breathing interruptions happen most commonly?
The disease that everyone should know about is obstructive sleep apnea,
Yeah.
where for some seconds of the night you are unable to take a complete breath in. So that could be either partially unable or fully unable to take a breath in. And because of this, you might be in deep sleep. But if you are unable to breathe,
Yeah.
uh, the level of your brain that is conscious, it could be deep down in your limbic system or it could be in your brain stem, वहाँ पे stress is felt that, oh, you are not able to breathe. And
So something's not right, you have to wake up.
something's not right, you have to wake up. And sometimes people do wake up. Sometimes they may not even fully wake up. They may wake up a little bit to just to add more pressure to their breathing,
Yeah.
to add more force, to recruit more muscles so that they can inhale more forcefully.
Yeah.
And then the breath goes in and then they might go back to sleep. So they may not even remember waking up,
Yeah.
but that doesn't mean that their sleep did not get fragmented.
Yeah.
So someone could wake up at 8 a.m. thinking that I slept at 12, I woke up at 8, I don't remember waking up at night.
Yeah.
Why do I feel tired?
Yeah.
And that is because of these hidden breathing problems
Yes.
that is happening.
So most of the times it's not the patient who is aware of the problems. It's the bed partner who actually comes to you and says, this person goes in bed and snores for a while and then chokes in the middle of sleep and then suddenly wakes up again, turns around in bed and starts snoring again.
Yeah.
So that is not a deep sleep. That is not a right, healthy way to sleep. That is one thing that I think we all agree upon.
That's a definition of interrupted sleep, right?
Yeah.
He is not reaching the basement. He is just, like we were talking earlier, he is in step 1, step 2, then going again in step 1, step 2, and he's basically cycling there the whole night.
Yeah.
So he's not spending any time. So he's neither physically recovered, neither mentally recovered.
Yes.
When he wakes up in the morning. So he's both. But in a way, even without feeling that freshness bit, a lot of people suffer at a subconscious level. I mean, it's like, the most common thing would be somebody sleeping with a night of cold. Bad cold, bad nose block, and you've had a bad night because you've just not been able to transition into that safe breathing space.
Yes.
Whereas there will be a big bunch of snorers who are snoring to glory.
Yeah.
When they wake up in the morning, they feel reasonably fresh.
Yeah.
But still, at a subconscious level, if you check their oxygen levels, if you check their heart rate variability, it's not healthy. So the damage can still happen even when you are not registering. So one part is definitely the guys who wake up the way they wake up. They don't feel fresh. But there will be a significant subgroup which seemingly feels fresh but may have a heart attack in the night because their heart is getting pounded.
Yeah.
They are not getting the right oxygen levels. They're still struggling.
Yeah.
So it's very important to be, essentially aware.
So during
Either
one
way.
of these conferences that I attended recently, I was chatting with one of my professors and like you said, subconscious debt is one thing that these guys often pay.
Yes.
And he was of the opinion that most of the sleep apnea patients present to psychiatric clinics and not just neurology or pulmonology or ENT, they often have depressive symptoms, often will complain of mood disorders.
Yeah.
And so many of these patients will present to a psychiatrist. So
Yeah.
it's as important from a psychiatry point of view that our psychiatrists and our physicians understand the importance of sleep
Yeah.
when it comes to
If they go to a psychiatrist, I mean, we are a country where we still, I mean, I would say urban India is becoming attuned to the idea or open to the idea.
yeah,
But I don't think a large part of the country has the awareness to go to a psychiatrist, has the access to go to a psychiatrist. I don't think there are many psychiatrists practicing, correct me if I'm wrong, in tier 3 or, village level places where, essentially they'll go to their family doctor.
Yeah.
exactly. So
They'll
the
feel
physicians,
tired.
yeah,
They'll get vitamin B12 shots.
yes,
They'll get
Yes.
vitamin D shots, and they'll be given
Alternative
multivitamins,
medicine.
something else. They'll try homeopathy, but they still feel
Yeah.
tired all the time because they are not breathing well enough in
but
the
still
night.
I think escitalopram and other antidepressants are much more commonly prescribed by a physician than a psychiatrist.
I mean,
So-
yeah,
So the physicians do end up treating depressive symptoms.
Absolutely.
and they
Absolutely.
have to be
Absolutely.
aware of this sleep
no,
related
I'm not.
problems.
So what I'm saying here is, Anupam, is yes, all mental health issues will get exacerbated.
Yeah.
A majority of them with the poor quality interrupted sleep. Problem is the acceptance or the referral is not so commonly done.
Yeah.
Because patients inherently have a very big, I would say, stigma to go to a psychiatrist. They are not very comfortable even when prescribed. Even when I tell them, like, I have to spend 15-20 minutes, convince them, and then they still come follow up with me.
Yeah.
And then third, fourth time when I put my foot down in saying that till you see that doctor, I'm not going to see you again.
Yeah.
Yeah.
So, I mean, that acceptance is an issue, and that is the reason that physicians have to do what they do. But idea being, again, is the awareness. If every physician is aware that how
Yeah.
sleep can worsen this,
Yeah.
then they will definitely.
So, talking about OPD patients, what are sort of your red flags to see in a patient? What sort of symptoms or signs, as to say, will tell you that this guy is potentially a sleep apneic and is not breathing properly at night?
I'll tell you very simple.
Yeah.
If you get a guy who, despite sleeping 7-8 hours, not feeling fresh, and even has the mildest form of snoring, that's the patient that will benefit maximally.
Mm-hmm.
Okay, so that is a patient we should never miss out. That doc, even on the weekdays, so I don't get sleep only. I get only 6 hours. But even on the weekend, despite getting an 8-hour sleep, when I get up in the morning, I'm not feeling fresh. This is your 35, 40-year-old guy, may or may not be obese, may not be snoring very loudly, maybe having a very mild snore. But that is one person that I would like to treat.
Yeah.
Very common in kids to look for signs of, I would say, restless sleep. If I see a kid who's, instead of sleeping like a log, kids should sleep like a log. Like if I see my daughter, once she falls asleep, the first hour I cannot shake her up. You can put on all the music and she's fast asleep. She's not moving around.
Kumbhkarna jaisa.
Absolutely. That is how it should be. Okay? But when your kid is struggling to find the right position in the bed, struggling to, like, positioning the head in a certain way, rotating the head in a certain way, and trying to open up the breathing passage, so to say, that's a red flag for me. Other things would be like daytime symptoms, like energy levels is another sign where by the afternoon or late in the evening you start feeling exhausted. There could be other factors too that can cause this. And also the fact that when you wake up in the morning, you rush for a glass of water, dry mouth. That indicates that you are breathing through your mouth throughout the night. So those are the typical signs, simple signs that people can look out for themselves. They don't need a doctor to ask them.
Yeah.
That's
What
something I
about a
realized.
neurologist OPD? What sort of symptoms you get and then you think about sleep apnea, that possibly this patient has a snoring disorder?
So disturbed sleep could lead to a whole variety of cases.
Yeah.
And a lot of them could end up with a neurologist. So the highest likelihood one would be migraine.
Okay.
So
Yes.
anybody with migraine, I ask for sleep, I ask for snoring, because poor sleep leads to autonomic dysregulation, which means that the nerves in your brain are unable to regulate themselves.
Yeah.
So whenever there's excess stress, that could be in the form of excess light, excess sound, irritability, excess just taking tension over some household event, they are not able to regulate themselves, and that dysregulation comes out as pain. So
Okay.
that is one of the core pathophysiology of migraine.
Okay.
Early morning headaches.
Early morning headaches, yes. Right, so these are very characteristic of disturbed sleep. What we already covered, mental health.
Yes.
So anxiety and depression often coexisting with migraine, with the underlying cause being poor sleep. So wahan pe you should definitely ask for this. People having sexual problems,
Yeah.
so erectile dysfunction or premature ejaculation,
Yeah.
again because of autonomic dysregulation, which can be because of poor sleep.
Yes.
And those patients also sometimes come to a neurologist.
Yeah.
People with other somatiform illnesses, so chronic fatigue syndrome, fibromyalgia,
Yeah.
Absolutely.
body aches,
Absolutely, yes.
unexplained pains.
Yes.
People with back pains, they will go get an MRI, there'll be a slight disc
They
bulge.
would blame it on that bulge.
Yes, and then somebody will say, tumko operation karna padega.
Yeah.
But you know that that's not the reason why. And just fixing their sleep with some mild physiotherapy, and they are fine.
Yeah.
So in these cases, asking for sleep apnea, asking for disturbed sleep, very important. Can save lives, can save them a lot of money,
Yeah.
save them from unnecessary surgeries.
Yeah.
So yes, these are the cases I would ask for.
One thing is patients, are very educated, but in the case of sleep apnea, they'll not come and say they have sleep apnea. They'll not come and say that they have snoring. They will not correlate snoring with their not feeling fresh in the morning.
Yeah.
Because they may be snoring like for a long period of time. The body was compensating, and the lack of feeling fresh or the non-refreshing sleep may be a recent phenomenon.
Yeah.
So it is for us to figure out, typically if I get a couple in their 40s and the guy is not feeling fresh getting up in the morning, they've been married for 15 years, he's snoring to glory for 15 years. But that freshness issues, the tiredness issues, the falling asleep during meetings issues has started in the last 2 years.
Yeah.
So how do you expect that guy to correlate snoring with that?
Right.
Because he's been snoring forever, right?
Yeah.
So it's very important for us to scratch the surface. Very important for us to ask for it.
Yeah.
And it's very common. It's highly prevalent. So you will never go wrong.
So talking about prevalence of sleep-related breathing disorders, especially obstructive sleep apnea, one of our AIM study told us that about 11 to 15% of Indians are suffering from it. And so many of them are kids. So coming to kids, what sort of symptoms or what sort of signs do the parents tell you that this particular boy or girl is suffering from breathing issues at night? What makes you think that this patient requires my help?
So upfront, the easiest symptoms to point out is snoring and mouth breathing at night.
Yeah.
So that's the simple ones to pick up. These kids may have grinding of teeth intermittently. They may have bedwetting issues.
Yeah.
They are generally very restless sleepers. Another symptom that we look for is the posture in which the child is sitting when the child is coming to our clinic. So typically they will have a forward neck posture and they will be they will always be sitting in front of us. And essentially what they are having is a bad nose block for which they are not complaining. Because the block is in the backside of the nose, it's not that symptomatic during the day.
Yeah.
The child has
Body
adapted
compensates
to... Yes.
for
The
that
child
block.
has adapted because that's what children do. They don't complain, they adapt. We don't want them to adapt, but they adapt to mouth breathing.
Yeah.
So those are the typical things that we look for.
How do you treat these children? How do you go about counseling their parents?
The easy part is a lot of these parents read up and come.
Yeah.
But for the uninitiated parents, I have a few photographs. We can show them where we show the level of obstruction, where exactly the block is happening, and why is the child sleeping the way the child is sleeping. And most parents are able to correlate. Some who don't, I tell them, you know what, I'm just going to orient you, just going to make you aware. Why don't you observe this over the next 2-3 weeks, month perhaps, and then come back to me, because it's very difficult for the parent to remember the posture in which the child is sleeping at night. मुंह खुला था कि नहीं खुला था.
I always
whether the
ask them
child-
to make sleep videos, which is a very
that
like
is
kind
one
of
way, yeah, like a 30-second video.
generating tool for the parents.
Absolutely.
It makes them aware. Plus, it gives you a heads up as to what
Yes.
the actual issue is, and compare it to what the parents' version of the problem is.
Absolutely. So you can point things out, and you can do a sleep video also to look for it. But essentially, it's just about making parents aware that as simple as this, it's a nose block issue, which is getting compensated. The compensation is troublesome.
Yeah.
And that is why we want the child to naturally be nose breathers and not be mouth breathers. That's all. It is as simple as that, or as complicated as that. And then there is how the body adapts and causes bruxism or grinding of teeth to happen. How the body adapts and creates snoring. How the body and adapt. A lot of kids actually may have attention deficit issues.
Yeah.
Maybe hyperactive.
I think that
because
that's
yes,
the kind of patient Dr.
Sid will get. Yes.
Yeah.
ADHD child running around, messing around with all the sophisticated gadgetry of your clinic.
Yeah.
And
Yeah.
and such a child, they would often be misdiagnosed as ADHD, which I'm not exactly complaining about. But the thing is, so often you would not see many of the doctors reaching to the depths of it and asking about their sleep history and other sort of causative factors leading to that attention deficit hyperactivity disorder that they so often get diagnosed with.
So across the board, any kind of psychological manifestation will have some physiological root cause.
Yeah.
Now, in some cases, we know what the root cause is, in some cases, we don't. But I truly believe that all these diseases like anxiety, depression, even ADHD, OCD, there are physiological root causes that end up in these symptoms.
Yeah.
And the same understanding we are also getting in metabolic diseases like diabetes. So diabetes is a symptom. The disease is something much bigger.
Yeah.
Right? So just sugar going up is not diabetes.
Yes.
It's a much bigger thing, and we
Absolutely.
are still understanding what diabetes is.
Yes.
And we've had much more time to deal with diabetes than mental health.
Yes.
So ADHD is one of those things. We are now only beginning to understand what ADHD is. And one of the reasons for ADHD symptoms is poor sleep.
Yes.
So absolutely, when a child presents with ADHD symptoms, just pointing at the child and saying this is an ADHD child is only the beginning. There is a lot of work that goes after that, finding out why does this child exhibit these ADHD symptoms?
Yes.
How much of those causes are changeable or modifiable? And what can we do to change them? And sleep is top of that list.
Yeah. So how do you go about curing these breathing problem patients, these sleep apnea patients? Let's talk about adults first.
So the first thing that we need to know is we need to know where we are starting from. In the sense, I need to know how severe of a problem I'm dealing with. So a simple sleep study,
Quantification of the
quantification. I mean, it's like when I'm treating diabetes for that matter, I need to
Blood
know
sugar
whether
lena
I'm,
pehle.
whether I'm dealing with someone who's like a borderline diabetic or someone with a sugar of 400 and, you know, may go into some severe complication of it. So we need to know through the sleep study where the child or the adult is in terms of the mild, moderate or severe variety. Second is I need to know, is there, and not for all, but is there an anatomical obstruction, in the sense the actual breathing
Any
passage
mechanical
obstruction along the
inside
way.
the breathing
Yes.
passage.
So we may just do a quick scopy in the clinic. It's just a 5 to 10 minute thing where we put in a camera inside the nose and have a look. Or I may end up doing a CT scan depending
on the cooperation
of
level of the child.
and also the child or adult and how much of a block that I'm envisaging. So that's the initial part, and then you decide depending upon what the symptoms are, how open the patient is to kind of like, see, the challenge is, given the awareness levels, what ends up happening, if I'm going to advise a sleep study, I know the patient is not going to come back to me in 3 days, but it's more likely going to be 3 months. So then wo hota hai, it's just a slow process because it's still not sunk in the gravity of the scenario. And then depending upon the severity of the problem, 2 standard advices that I give across the board. One is, if the patient is overweight, I make them lose weight as much as they can. At least I sensitize them to that. Sometimes, like I said, it's difficult to lose weight without settling the original issue. Lifestyle management. Second is, I start them on some kind of a breathing exercise as much as they can do. If it is a child, it will not be very cooperative. But if it is an adult, every one of them gets an exercise recommendation. If somebody is going to put in the effort, then I have like colleagues who specialize in training patients. Otherwise, I mean, there is a lot of, I would say, good quality videos available where people can do it on their own in the home. There are so many pranayam classes available. So culturally, we are very oriented to pranayam.
Mild form of sleep apnea can be tackled with stimulating nasal breathing. That is what I understand. And letting go of the mouth breathing habit if the child has or the adult has.
Again, I mean, see, so the controversy or rather the discussion that we have in larger platforms on sleep apnea is, how do we say what is mild? Do we say mild only on the basis of sleep study? I may have a very mild sleep study, but a very bad nose block. No amount of breathing exercise is going to help that person till I fix his nose, which may involve some surgery. I may get a guy who's technically a severe sleep apnea, but he does not have anything that I can, or there is no surgery which will help him. So in those cases, definitely I can jump onto exercises. And what we need to know and understand is, like diabetes, it's something that will take time. It will require teamwork. It's not a quick fix. It will not be one weight loss. It will not be one exercise. It will not be one surgery. Or what we prescribe to a lot of our patients is a PAP device, or what we call as positive airway pressure therapy. It's a mask that they have to put up in the night, and it's a pressure device which actually opens up the airway.
Breathing passage.
Yes. So even that, I feel it's a very good solution, but I mean, it's all about finding the right patient for it.
So there are different methods available. Broadly speaking, lifestyle management, PAP therapy.
Yes.
Then you can have a surgical solution to the problem. And another solution that I so often recommend my patients is going to see a dentist and getting an oral appliance.
So that is very good for adults.
Adults,
For kids, I'll like to change the order a little bit. Okay, for kids, the surgery perhaps may come in earlier along with medications.
Must be the first option that should
because
be
not many kids will be comfortable with the PAP therapy.
Yes, but for adults, I think these are the 4 major options, and I think lifestyle management plus stimulating nasal breathing is these are 2 things that can be advised to everybody.
And they are very good. What I tell them is, surgery or PAP therapy will get you to a good place. What maintains you there is lifestyle and exercise. It's very rare that lifestyle and exercise in isolation will get a frank sleep apnea patient over the fence. You have to get him to a safe place and then maintain him there. So that's very important, to do that initial part very well, get him to a new good place, and then make him kind of like, self-sufficient or self-reliant to maintain himself there.
So Dr. said, a philosophical question for you. So most of these patients are not exactly having any trouble on their own. They are snoring their way to glory, and it's their spouse, I should say, not I won't use
bed
the word
partner.
I won't use the word wife. Their spouses or bed partners would take them to our clinic. This guy is snoring, and you evaluate, you find that this guy is obstructive sleep apnea, guy or lady, whatever. So these sort of patients don't exactly have a problem of their own. How do you convince them that they require some form of treatment to salvage themselves.
The challenge is much harder when they are brought by their partner
Yeah.
just for snoring. So if they don't think that they are a patient, it's very difficult to convince them. Not impossible, but it's difficult. Usually that's not what happens, at least in my practice.
Yeah.
Usually the person has come with some issue, and on questioning, the partner will say that yes, they snore.
So you attribute that particular issue to this particular
Yes.
problem, and then they probably get convinced to get it treated.
Yes, then they take it more seriously.
Then they take it
because they are already in a solution finding mode.
Yes.
They have already come to your clinic with the mentality of I want to find a solution.
Yes.
So when you offer a sleep study as part of the solution, they are more accepting.
Yes.
But if they have been brought by the partner, they are not in a solution finding mode because according to them there is no problem.
Yeah.
So why should I put in the effort when there is no
Exactly.
problem?
Exactly.
Yeah.
So in India, we are still not at that stage wherein we see routine divorces happening because of snoring. I think we'll get to a stage in the near future.
No,
maybe
it's not about
15
divorce
years.
also. I think divorce is a complex issue where snoring is just a reason.
Yeah.
Or
correct.
like, the label that people put that, I mean, divorce is far more complex than that.
I don't think snoring has ever broken up a happy marriage.
Yeah.
Exactly. So it would not trouble. But the way I would look at it is, say, if I am the snoring guy, I may be asymptomatic. Because I was never aware that my anger issues or my tiredness issues were because of my snoring. So
Okay.
that's one part of it. But I will, if I am the patient and if a doctor tells me, this is serious stuff, I would go and Google it, right? I will say, let me just read more about it because it's easy to do. And there is enough literature out there to suggest that even the asymptomatic snorers, especially if they have severe sleep apnea, on a sleep study needs treatment.
Yeah.
So I think awareness is there if somebody wants to dig out. But then we will always have a person with the ostrich phenomena, with the head dug in the sand, and he's like, मुझे कुछ नहीं हुआ है, मुझे कुछ नहीं हुआ. तो वो तो मतलब I think diabetologists have dealt with those people for at least a couple of decades, if not more. Now nobody says कि मुझे diabetes नहीं है, मैं हट्टा कट्टा हूँ, I will not take any medication.
Yeah.
But I think sleep apnea will reach there. I think the awareness levels hopefully will reach there in a decade or so that we can save some marriages.
The way I see it, we are probably a country seeking tertiary level solutions when we are still not at the primary level, wherein we would be thinking more about preventing stuff. So obstructive sleep apnea is one condition where we are trying to prevent a
Absolutely.
life-threatening event from happening, something like a stroke or a heart attack. And that is why probably the acceptance of the therapy is not at the level wherein the acceptance of therapy for heart attacks or strokes or maybe a cancer is.
Depends upon your target population.
Yeah.
We are not a uniform country. We'll get people who are seeking levels of care at par with
So probably the more educated people would
aware people.
fall
Yes.
in that
Yes.
bracket of
Yes.
primary level prevention.
Yes.
But most of the
Primary
country
level to
still
nahi, but
is-
at least secondary level prevention, yes.
Yeah.
Most of the country will come to us once they have met with an accident or a heart attack, and that is if their cardiologist is aware that there is something called as sleep apnea and that needs to get fixed.
So I think if cardiologists start screening for it, maybe they'll find so many of their heart attack
they
cases
will
Absolutely.
definitely.
being attributed.
Cardiologists, neurologists, physicians, psychiatrists, diabetologists,
Yeah.
All of them.
everyone.
Yeah.
So a sleep study should become part of a panel, actually.
Yes.
Because I have found that out of 10 sleep studies that I ask, 7 come positive,
Yes.
which means that I must still be missing out on so many.
Yes.
Just the fact that 7 out of 10 are coming positive, if I look at any other study, if I look at all the patients I ask for a thyroid function test,
Sure.
Yes.
I might be getting 1 out of 50 positive.
Yes.
So 7 out of 10 is a crazy number.
Yes.
So I should be asking
Screening
for a
more.
lot more.
Yes.
The thing is that it's not an easy thing to screen for. The patient also has to go through some amount of commitment. They have
Absolutely.
to sleep with that machine through the night.
Yes.
The technician has to come home.
Yeah.
Maybe one way forward would be to have an easier test.
Easier way of screening.
Screening.
So there are newer tests coming up where it's just like a watch.
Apple Watch.
So
has-
Apple Watch is, I think probably a generation or two short from becoming the category, and I don't think many people can afford. Even in from the larger aspect, I'm saying at a national level, an Apple Watch, but you get these commercial devices where they will be, so they're based on two technologies. One is on the oxygen saturation parameters, where they're able to look at the waveform of the oxygen saturation parameters, and they can tell you, like, and they will not miss out on a severe sleep apnea.
Right.
So they are very good screening tools, easy to do, just like wearing a watch and having a finger probe and getting it done. But they'll not be very good in detecting borderline cases.
Yeah.
So there are alternatives.
Right.
But at the end of the day, I mean, there is a cost attached to everything that we do. And I think we can be better at screening individuals. I think a good start will be not to miss the garden variety severe sleep apnea guy who will respond, severe symptomatic guy who will respond phenomenally to therapy.
Yeah.
And the next step would be to kind of like, at a population level, at a large scale level, tackle the asymptomatic guys also.
Yeah.
But I mean, I think if we can just tap onto the symptomatic guys and catch hold of them.
So the burden is huge, and probably if you just start treating the symptomatic
Absolutely.
guys first, you will
Yeah.
save on so much of economy and so much of healthcare related costs.
Yes.
So you talked about surgical solutions to sleep apnea. What sort of surgeries are there that are most commonly done to help a guy with sleep?
So see, the intention of any surgery is to make a wide open airway.
Yeah.
You have to assess what are the levels at which the airway is obstructed.
So the airway will mean
Airway means starting from the
to
nose,
lungs.
starting from nose to the lungs in the broader perspective.
Yep.
But
The complete breathing passage.
complete breathing passage. But primarily the block exists essentially between the nose and your voice box.
Yes. The upper
Beyond the upper part of the airway. The part of the airway below your voice box is essentially not collapsible.
Yes.
It's called your trachea or windpipe. So it's pretty sturdy for the most bit. I'm not talking about exceptions. But for the standard patient, those parts are pretty sturdy. Your collapse can happen anywhere from the nose, back of the nose, back of the throat, around your tonsil areas, or lower down around the tongue area. Our job as a surgeon or as a sleep apnea specialist is to figure out which of these areas are obstructing, to what degree, and whether surgeries or which surgeries can fix them the way we want to. We need to remember not every patient will benefit from surgery.
Yes.
So whenever we are doing or offering surgeries to patients with sleep apnea, we should be very careful in identifying the right patient.
Yes.
Because you have the non-surgical solution, which is PAP therapy, available for them. So we should not venture onto surgeries. Having said that, in the right candidate, these surgeries are not major surgeries. They are not like your heart or brain surgeries, where there is a lot of risk to life and limb, and the risk factors are not very high. These are principally, I would say, routine surgeries, but we do as a set.
Yeah.
So if the block is in the nose and the palate, I will do a routine surgery at the level of the nose and the palate, at the level of the palate. And in isolation, they are not big surgeries. Because I combine them, they become longer. But I would say in a 10-day period, the patient is back to his feet, and there is essentially very little or no permanent downside.
So you basically make
Wider.
the breathing passage wider to help the patient breathe better, because
Just a mechanical
some
solution.
sort of collapse is inevitable during sleep.
Absolutely.
That will happen.
Yes.
So your job is to, suppose, let's say airways 100, you make it 150, so that even if collapse is happening, it doesn't collapse to a critically narrow passage.
So the way I explain to patients is, actually I tell them, in a regular guy it's 100. In your case, it is perhaps 70.
Yeah.
Okay. Now, which falls further because airway collapse is known to occur during sleep.
It will happen.
So what I need to do is push your airway from 70 to perhaps 90.
Yeah.
so that you can tolerate the collapse better. That's how I tell them. I may not be able to make it 100, but I can at least make it 90, 95. In kids, we are able to achieve that elusive 100. So for me, if you ask me, I mean, the question that I want to answer is, what is the best age to fix this? Is in
As
the
young as
pre-teen age.
possible.
As young as possible. In the pre-teen period, I want their breathing to be fixed. If they are complete nasal breathers before they enter their teenage, I don't think they will need me beyond that. If they are reasonably good breathers before that, they don't need me beyond that.
Because you have widened the passage, you have set in process,
The right, yes,
you have set in cascade the right sort of events.
Absolutely.
So the breathing passage reaches and grows to the right stage and the right dimensions.
Absolutely.
Makes sense.
So how do you deal with this patient who comes to your OPD and says, मैं जब दारू पी के सोता हूँ, whenever I drink alcohol, I snore. Otherwise, I'm fine. So how do you tackle this sort of a patient?
We'll tell them alcohol is bad.
That is the first thing to do.
So
yes.
alcohol does contribute to your airway collapse, and it does contribute to the problem underlying.
I mean, I think we have normalized alcohol beyond the safe limits. I feel. I mean, we were well off 20 years ago as a society when alcohol was still a taboo and it was not like we have just normalized it. It's like, drinking is just like grabbing a soft drink in a party and you can just gulp it down and behave the way you want. So that's one part of it. We should not do that. But the second part is essentially, yes, alcohol will make things worse. Even in, say, quote unquote, a regular guy, alcohol has a lot of bad effect on the sleep per se. And the sleep apnea guy will just become worse. So, I mean, we'll tell him to do and become a normal guy in the sense, lose weight. On a good day, do exercise the day that you are not drinking. So that will improve your chances of snoring with alcohol. But I can't think of a practice in which I can make a person snoring free, ki how much ever alcohol he wants to drink, ki आप जितना पीना है पी लो, now you are set for life. I have operated, you will never snore. Even a person that I have operated is likely to snore once he's down a few pegs. So that's the thing.
So lifestyle management will include a bit of alcohol limitation, and maybe if the guy
is an understatement. But yes.
So if the guy is an active smoker, getting the smoking off the cards also.
So I mean, yes, that's general advice. But like I said, the research evidence is more for alcohol and sleep apnea. Smoking and sleep apnea, the evidence is not so strong, but we would want him to become healthier. I mean, we are treating him and not just the sleep apnea. So we would want him to quit smoking too. But I think smoking related awareness is still out there. Alcohol is where, like I said, the normalization is something which is very, I would say, tricky to manage.
So during MBBS classes, we used to have this professor who used to ask us if you have to have one single factor to improve the lifespan of humans across all countries, it will be smoking. Like you have to let go of smoking. But I now strongly feel that contributing to a better sleep and getting a better sleep will equally increase your lifespan and, prevent all those diseases, terminal diseases like heart and brain and cancers. So it does have a role to play, and I think it's a very strong health hack that we must all be aware of. So any parting words, Dr. Sid?
I would say that sleep is something we are, as a society, still coming to terms with. Because currently all our priorities are on achievements. And sleep does not feel like an achievement because it feels like it is something that our body does by itself. It's not that I have to do it. But I would say we should change that. I would say we should change the way we look at sleep from a passive to an active activity. Sleep is something that you do. And there are some who sleep better and there are some who sleep worse. Just like there are some who are better students, some who are worse students. There are better sleepers and poorer sleepers. And you can go from a poor sleeper to a better sleeper. And that will help you. So thinking of sleep as an active exercise, something that you actively do to help your life, is a good framework.
Nice. Dr. Rahul?
So I would say what you said earlier, I liked it. Sleep is an investment and not an expenditure. If you don't feel fresh despite getting the number of hours, 7-8 hours, definitely seek help. And keep things simple. Like, like you said, I'm a big fan of as much as discipline we can maintain. Sleep on time, wake up on time, and look for signs that we have discussed: snoring, mouth breathing, feeling tired during the day, or just not able to feel sleepy at night. These are not healthy things if they are happening over a prolonged period of time, over a period of months. So look for help there. So don't ignore, I would say, sleep issues would be my message.
So that was, I think, a wonderful message put across by both of you. And I couldn't be more happy having you two as the guest on this podcast. And I thank so much. Like, this was most likely the best podcast I've ever recorded till now. So thanks to both of you, and hope to see you soon again.
Thanks for calling us.
Yeah, thank you for having us and having us on such an important topic.
Yeah.
Thank you.
So that was a World Sleep Day done nicely. Thank you.
Thank you.
Cheers. Good night, everyone.